Welcome to The Explainer. Today, we're looking at a procedure you probably just associate with getting older, geriatric cataract surgery. But as we'll discover together, it goes way, way beyond a simple routine optical tune-up. We're talking about profound, literally life-changing physiological protections for your brain, your body, and your independence.
Okay, let's dive into this. What if I told you that a super quick 15-minute eye surgery could actually act as a shield against cognitive decline? I mean, it's so easy to just assume cataract surgery is strictly about fixing blurry vision so you can read the morning paper, right? But while that's obviously a fantastic benefit, the reality is far more fascinating. Restoring your vision might actually be the absolute key to unlocking systemic health protections that fundamentally alter the trajectory of how we age.
Section 1. More than blurry vision, the catalyst of aging eyes.
Before we get to all those broader benefits, it really helps to understand what's actually going on inside the eye. So, as a patient approaches their late 70s, the structural proteins in the lens, they're called crystallins, naturally start to clump together from years of cumulative oxidative stress. That once crystal clear window becomes a really cloudy, rigid barrier. But the definitive treatment, which is modern phacoemulsification, is just remarkably elegant. In only 15 to 30 minutes, this outpatient procedure, which boasts a wild 98% success rate by the way, takes care of it. The surgeon uses high-frequency ultrasound, which you can kind of think of as a microscopic, incredibly gentle jackhammer, to break up that cloudy lens and replace it with a pristine, artificial intraocular lens. And that little lens? It's the gateway to the much deeper physiological protections we're about to explore.
Section 2. Protecting your brain. The domino effect on cognitive health.
Let's look at the Adult Changes in Thought study. They tracked thousands of older adults and uncovered this truly staggering statistic. Participants who underwent cataract removal saw a nearly 30% reduction in their risk of developing dementia. 30%! And what's even more mind-blowing is that this massive risk reduction is incredibly durable. It persists for more than 10 years following the surgery. It basically realigns the cognitive trajectory of these patients right back with healthy individuals who never even developed cataracts in the first place.
So why on earth does this happen? Well, the biology here is just incredible, and it boils down to something called the sensory deprivation hypothesis. Think of your brain like a muscle. It absolutely relies on continuous, high-fidelity sensory input to maintain neuroplasticity and keep things active. When a cataract degrades your vision, your brain has to work incredibly hard, exponentially increasing its cognitive load just to process distorted, fuzzy information. This constant, exhausting strain can actually accelerate cortical fatigue and potentially lead to brain atrophy. By restoring clear vision, you're directly stimulating and exercising those neural pathways all over again.
And you know, on a deeply human level, severe vision loss forces people into social isolation. You can't recognize faces, you can't navigate public spaces safely, so you just stay home. And social isolation, all by itself, can increase the likelihood of developing dementia by a whopping 50%. Clearing up those cataracts actively prevents this isolation. Interestingly enough, studies show that other eye surgeries, like treatments for glaucoma, which don't necessarily restore lost vision, do not offer this same cognitive protection. It is the specific restoration of that high-fidelity visual input that acts as a shield for the brain.
Section 3. Preventing dangerous falls, the physical shield.
We've talked about the brain, now let's talk about the body. Just compare these two realities for a second. Pre-surgery, a patient is dealing with terribly poor contrast and basically no depth perception. Imagine the terrifying reality of trying to navigate uneven sidewalks or misjudging that crucial bottom step on a dimly lit staircase. It creates a horribly high risk for catastrophic bone fractures, which, let's be honest, are so often the tipping point for a total loss of independence in older adults. But post-surgery, spatial awareness is totally restored. Safe navigation returns. Fixing that lens directly mitigates these fall risks and gives patients back the physical autonomy they need to stay active and healthy.
Now, because cataract surgery is almost always done on one eye at a time, patients do go through a temporary, but quite severe, imbalance in their depth perception right between their first and second surgeries. During this highly vulnerable little window, being proactive about home modifications is an absolute lifesaver. Seriously, you've got to remove those trip hazard throw rugs, install plenty of night lights, get grab bars in the bathroom, wear sturdy rubber-soled shoes around the house, and please move very slowly when going from sitting to standing to avoid getting dizzy. It's just a really short period of extreme caution that pays off with a lifetime of benefit.
Section 4. Keeping your license. The keys to autonomy.
For For so many older adults, holding onto the car keys is the ultimate symbol of independence, right? Well, untreated cataracts directly threaten a senior's legal ability to drive, especially here in Ontario. Under the Highway Traffic Act, your optometrist or ophthalmologist isn't just making a friendly recommendation, they are legally obligated to report visual impairments to the Ministry of Transportation of Ontario, the MTO. If your cataracts drag your vision below the legal limit, it routinely results in an immediate mandatory suspension of your driver's license.
Now, what's really interesting about this slide is the precise MTO standards we're looking at. A standard Class G license requires a minimum visual acuity of 20/50 in your better eye and a continuous horizontal visual field of at least 120 degrees. Cataracts very frequently cause patients to fail these exact metrics. But here's the good news. Once the surgery is complete and your vision is stabilized, your doctor can submit a Form 3649, that's the MTO Vision Report form, to officially reinstate those vital driving privileges. It is quite literally your medical pathway right back to the open road.
Section 5. The Ontario Care Pathway, Navigating Local Health Directives. So, how do you actually navigate this whole process within the Ontario healthcare system? Well, the entire structure is built on this fantastic collaborative loop known as the co-management model. Step 1. Your local optometrist diagnoses the cataract and makes the formal referral. Step 2. The ophthalmologist, who is the surgical specialist, steps in, performs the advanced biometrics, and does the actual surgery. Step 3. You're transferred right back to your familiar local optometrist for your post-operative recovery and long-term monitoring. It's a great system that ensures you get world-class surgical precision without totally overwhelming the specialized surgical centers.
Let's demystify the financial side of things for a second, because this causes a lot of folks unnecessary anxiety. Under the Ontario Health Insurance Plan, OHIP, all medically necessary components of the surgery are fully funded. That means the surgeon's fee, the facility, the anesthesia, and a standard monofocal lens that gives you pristine optical quality, it is all covered. The only time you're looking at elective out-of-pocket costs is if you personally choose lifestyle upgrades. Things like laser-assisted refractive incisions or premium lenses designed to ditch the reading glasses. And remember, Ontario law explicitly prohibits queue jumping. You absolutely cannot just pay cash to get your medically necessary surgery done any faster.
Now, before anyone goes into surgery, there is a crucially important medical warning you need to hear. If you are taking or have literally ever taken tamsulosin, you probably know it better as Flomax for prostate issues, you absolutely must disclose this to your surgeon. This medication permanently alters the iris muscles in your eye, and it causes a surgical complication known as intraoperative floppy iris syndrome. And no, the risk doesn't magically go away even if you stopped taking the medication years ago. The good news is, if your surgeon knows about it beforehand, they can easily use specialized tools to stabilize the pupil and keep the surgery perfectly safe. Just whatever you do, do not keep it a secret.
To make sure that beautiful new lens heals up perfectly, there are a few golden rules for your post-op recovery. First off, because you're getting sedation, there is absolutely no driving or alcohol for 24 hours, no exceptions. To prevent dangerous pressure spikes inside the eye, you've got to avoid heavy lifting or bending below the waist for a week or two. You also need to wear your plastic eye shield while sleeping. Yeah, I know, it's not exactly high fashion, but it's essential so you don't rub your eye. Strictly keep tap water or shower water out of the eye for 2 weeks to prevent severe infections. And lastly, aggressively use artificial tears because surgical dry eye is super common while your corneal nerves are healing up.
So, as we've seen today, cataract surgery is so much more than just an optical tune-up. It's literally a shield for your brain against dementia, a crucial physical protector against dangerous falls, and the absolute guardian of your legal independence and mobility. Sure, aging definitely brings its biological challenges, but it absolutely does not mean we have to fade away into the blur. Knowing what you know now about the hidden superpowers of this everyday procedure, isn't it time to take charge of your sensory health and step back into a vibrant, high-definition world? And it really makes you wonder, doesn't it? What other subtle biological changes might be secretly holding back your longevity right now? Thank you so much for joining me for this explainer. Keep exploring and keep your vision clear.